Children and ear infections. A common illness called an ear infection causes the middle ear to swell up and become infected, frequently as a result of viruses or bacteria migrating from the nose or throat. It primarily affects kids who have symptoms like fever, irritability, and temporary hearing loss in addition to ear pain. Infections of the ears are extremely typical in infants and young children. They are among the most frequent causes for parents to bring their kids to the pediatrician. Although they can happen at any age, ear infections are most common in children between the ages of 6 months and 2 years. By the time they are 3, statistics indicate that almost 5 out of 6 kids will have experienced at least one ear infection. Around 80% of kids will have had at least one episode of an ear infection by the time they turn 3. Children who attend daycare or have a family history of repeated ear infections are at higher risk, as are boys who tend to be more sensitive to ear infections than females. As children get older and their immune systems develop, the frequency of ear infections tends to decrease. By the time a child is 5 years old, ear infections are much less common. This is due to the fact that as children develop, the structure of the eustachian tubes, which connect the middle ear to the back of the throat, changes, enabling improved fluid drainage and lowering the risk of infections. Although ear infections are frequent, it's important to remember that not every child will get them, and the frequency and severity of infections might differ from child to child. It is always advisable to speak with a healthcare provider for a precise diagnosis and the best course of action if you suspect that your infant has an ear infection or if you are worried about their ear health. Although it can affect adults, acute otitis media, AOM, is a frequent ear infection that predominantly affects children. The middle ear, which is the area underneath the eardrum, is affected and infected, which defines it. When germs or viruses migrate from the nose or throat to the middle ear during a respiratory tract infection, such as a cold or the flu, AOM often results. Some essential characteristics of acute otitis media include: children with AOM frequently have ear ache, which can be excruciating and gets worse when they lie down. Fever, agitation, trouble sleeping, decreased appetite, fluid draining from the ear, and transient hearing loss are possible additional symptoms. Adults may also have ear ache in addition to less severe symptoms. Streptococcus pneumoniae is the most frequent bacterial culprit in the majority of cases of acute otitis media. Other bacteria, like Moraxella catarrhalis and Haemophilus influenzae, may also be at fault. AOM can also develop as a result of viral infections, particularly respiratory syncytial virus, RSV, and influenza. Diagnosis. A medical expert will often make a diagnosis of AOM based on the recognizable symptoms and a physical examination of the ear. The examination may show redness, eardrum bulging, and fluid buildup behind the eardrum. Additional tests like tympanometry, which measures middle ear pressure, or a tympanocentesis, which collects fluid for culture, may occasionally be carried out. Antibiotics are frequently used to treat AOM in order to treat the bacterial infection. However, due to worries about antibiotic resistance, prescription standards have changed. A watchful waiting strategy, which emphasizes pain management and initially forgoes antibiotics, may be used in simple instances. Ibuprofen or acetaminophen may be suggested as painkillers to ease discomfort. After 48 to 72 hours, if symptoms don't improve or don't go away, antibiotic treatment could be started. The usual recommendation is for immediate antibiotic therapy in severe instances or when problems occur. While the majority of AOM cases are uncomplicated, some people may endure repeated infections or develop problems. Eardrum perforation, middle ear effusion, fluid accumulation, chronic otitis media, persistent ear infection, and mastoiditis, infection of the mastoid bone behind the ear, are all potential side effects. Additional medical treatment may be needed to address these issues. Promoting good hygiene habits, such as consistent hand washing, breastfeeding infants, avoiding exposure to secondhand smoke, and making sure vaccinations are up to date are some prevention strategies for AOM. For example, the pneumococcal and influenza vaccines can help lower the risk of ear infections. As individual situations may differ, it is crucial to speak with a healthcare professional for a precise diagnosis and suitable management of acute otitis media. I hope this gives you a better understanding of ear infections and why children are prone to them. If you like the content, please consider subscribing. Thanks for watching.